Each year, millions of children in the United States endure the trauma of abuse, violence, natural disasters, and other stressful events, which could have an adverse effect on their mental health. Joining me now to talk about it is Dr. Scott Shimabukuro, who is a clinical psychologist with the Hawaii State Department of Health, Child and Adolescent Mental Health Division. Aloha, Dr. Shimabukuro. Thank you so much for joining us.
Hi, thanks for having me.
Hey, Doc, today I learned a new phrase, secondary trauma. Can you explain what that is?
It's what happens when we, and by we, I mean any of us, experiences trauma symptoms like having intense worries or upsetting dreams from learning about another person's traumatic experiences. So even though we may not have had the direct experience of that traumatic event, we can start to have similar symptoms to people who did.
Wow.
It would be a mistake to think of secondary trauma as something that just affects first responders or mental health workers. When there's a community disaster like the Maui wildfires, we can all be vulnerable to it. Hawaii is such a special place where so many of us want to support our friends and neighbors however we can. But we need to remember this is a very real risk.
Absolutely. Now, when we're talking about the symptoms or the signs, what should we be looking for as, when we see our children or even our family members when we're talking about secondary trauma?
Yeah, common signs include things like emotional exhaustion, feelings of hopelessness, difficulty concentrating, irritability, trouble sleeping. You may even have physical complaints like headaches or stomach aches, and upsetting thoughts and images of events that you can't stop thinking about, even though you may try. People may also start to feel detached from their personal work or personal life or work. And it's important to notice any changes in your own mood or your ability to cope with everyday things. There is no shame in reaching out to your doctor or other professionals for help. For all of Hawaii to heal, we need to take care of ourselves too.
It's so important. I mean, that self-care. Back in the day when we were kids, it's like, hey, you know what, be quiet, go take a nap, or, however our parents or the generation above us handled those kinds of issues. But it is so important, and I'm so glad that you guys are at the forefront and actually bringing awareness to this so that we can malama each other and malama our keiki. So what are some of the ways that, we can manage the effects of secondary trauma today?
Sometimes people feel like self-care is selfish. It's not always easy, but taking care of yourself, you are taking care of your family and friends when you do that. When we don't tend to our own emotional needs, we eventually feel depleted of our energy and find it harder and harder to help others. This is sometimes referred to as the cost of caring. Regular things like exercise, hobbies, good sleep and nutrition, and relaxation go a long way to protecting yourself. But let's not forget that watching traumatic events over and over again on the news can be a problem. So stay informed, but don't overexpose yourself to these images and stories. And in Hawaii, we understand the importance of pilina, our connectedness and relationships. Some of the best ways we can support each other and ourselves are by checking in, listening, and offering connection. And if you do need further support, you can visit hawaiiheals.org to find valuable information and resources like ways to connect with others and how to support people of all ages.
All right, hawaiiheals.org. We thank you so much. Dr. Scott Shimabukuro from the Hawaii State Department of Health, Child and Adolescent Mental Health Division. Thanks for joining us, and thank you for, again, bringing awareness to this very important issue.